Welcome to This Explainer. Today, we are diving straight into the intense, honestly fascinating biomechanics behind one of the most painful, inflammatory conditions known to medicine: gout. If you've ever wondered how perfectly normal bodily functions can suddenly transform into a microscopic battlefield, well, you are absolutely in the right place.
Imagine waking up dead in the middle of the night, feeling like your big toe is literally on fire. The medical literature gives us this classic, visceral description where even the feather-light weight of a bedsheet is just absolute agony. It's not some dull ache, It's a fast, furious, severe pain that demands your immediate attention right then and there. When this exact nightmare targets the base of your big toe, the first metatarsal joint if we're being anatomical, medical folks call it podagra. Now, gout can absolutely strike your ankles, your knees, wrists, elbows, you name it. But this laser-focused strike on the big toe, that's its most famous and, frankly, its most infamous calling card. So here is our roadmap for today. 1. The infamous attack. 2. The uric acid problem. 3. Triggers and causes. 4. Treating the symptoms. And finally, 5. Managing chronic gout. Let's get right into it. Section 1. The infamous attack. A joint on fire. Let's look at what is physically happening inside that swollen red joint during an acute flare-up. The core of the problem here: monosodium urate crystals. These are incredibly sharp microscopic needles that literally drop out of your fluids and deposit in areas where your blood flow is just a bit slower. Places like the extremities, the joints of your toes are the perfect environment for these things to settle in, and in a matter of hours, they turn a perfectly healthy joint into a hot, red, tender war zone. It's a crazy chain reaction at the cellular level. First, the crystals form. Then, your body's immune system spots these sharp intruders. White blood cells basically rush the site to try and eliminate the threat. But, and here's the kicker, in doing so, they release cytokines and other pro-inflammatory chemicals. So that intense, localized pain and swelling you're feeling, it's not just the crystals themselves. It's actually the crossfire from your own white blood cells trying to fix the problem. Moving to Section 2. The uric acid problem, a molecular view. We know crystals cause the immune response, but what causes the crystals? Which brings up a really great question. Where exactly does all this uric acid come from? I mean, we don't exactly eat uric acid for breakfast, right? So how is our body making it, and why? Well, it all starts with purines. Think of these as little molecular rings. They're the fundamental building blocks of our DNA and RNA. Every single day, as your cells naturally break down and replace themselves throughout your body, the DNA and RNA inside those cells break down too. Those purines get converted into uric acid, which is typically just filtered out of your blood by your kidneys and flushed away in your urine. But here is the absolutely crucial part. Uric acid has a very strict solubility limit in your body, 6.8 milligrams per deciliter. If your levels push past that exact number of 6.8, your blood literally cannot hold it in solution anymore. A critical threshold gets crossed. And once you cross that line, especially right at our normal blood pH of about 7.4, a chemical reaction sparks. The uric acid loses a proton, it binds with circulating sodium, and bam, the result is monosodium urate crystals, literally precipitating as microscopic needles right out of your own bodily fluids. Section 3. Triggers and causes. The blood supply bucket. We need to figure out why the blood is overflowing with uric acid in the first place. Think of it like a bucket. Hyperuricemia, that excess uric acid, is essentially a basic supply and demand problem. We're looking at two distinct pathways here: increased production, meaning you're pouring way too much into the bucket, and decreased clearance, meaning the drain is clogged and you aren't emptying it fast enough. On the increased production side, your diet is a massive, massive factor. Eating purine-rich foods, we're talking shellfish, anchovies, red meat, organ meat, that directly adds purines to your system. But get this, it's not just food. Beverages sweetened with high fructose corn syrup actually ramp up your body's own purine synthesis. Other triggers include rapid cell breakdown from things like chemotherapy, or you might just have a genetic predisposition to produce too much of it. Now, what about the clogged drain? Decreased clearance can happen through something as simple as dehydration. If you aren't drinking enough water, things back up. Heavy alcohol consumption, chronic kidney disease, these all clog the drain too. Even totally standard medications, like thiazide diuretics or a daily aspirin, can inadvertently bump up those uric acid levels. Section 4, treating the symptoms, putting out the fire. Now that we deeply understand the mechanics, let's look at how the medical field tackles this beast.
It takes a two-pronged approach. First, for an acute attack, the immediate goal is just putting out that fire. Doctors use NSAIDs like ibuprofen, corticosteroids, or a drug called colchicine, which literally stops those white blood cells from arriving and causing that painful crossfire we just talked about. Then, for the underlying cause, we have meds like allopurinol. This is a game changer because it stops the production of uric acid right at the source, while other uricosuric medications like probenecid help your kidneys flush more of it down the drain.
But hey, medications aren't the whole shebang. Lifestyle modifications are huge here. Staying well hydrated with water keeps the kidneys flushing. Reducing, or better yet, totally eliminating soda and alcohol and pulling back on red meat and seafood can make a massive difference. Also, staying active to ward off obesity and diabetes is absolutely critical, because both of those are known risk factors that just throw gasoline on the gout fire.
Which brings us to Section 5, managing chronic gout, the long-term threat. What happens if we just ignore all these warnings?
Well, if left unmanaged, it stops being a series of isolated attacks and morphs into a chronic disease. We're talking about permanent deposits of urate crystals forming along the bones, right beneath the skin. These deposits are called tophi. They are literally a physical, highly visible manifestation of chronic gout that has been ignored for too long.
The timeline here is pretty sobering. What starts in the days to weeks phase as an acute attack with localized pain can, over months and years, lead to permanent joint tissue destruction. And if we look out over years to decades, you get those tophi forming beneath the skin, and worse, those uric crystals can deposit directly into your kidneys, causing kidney stones and permanent damage known as uric nephropathy.
Gout is just a terrifyingly brilliant example of basic chemistry happening right inside our own tissues. But here's the good news. By understanding that exact threshold, that's 6.8 milligrams per deciliter where harmless molecules turn into painful spikes, you hold the power to change it. You know exactly how the supply and demand bucket works now. So knowing all this, what small dietary or lifestyle change will you make today to keep your internal chemistry balanced and protect your joints for tomorrow? Thanks for diving into the science with me today on this explainer.